Hi, I'm Trista Crick with USA Today Sports, and I am with the bus and Dr. Freedhand from Stryker Orthopedics. Sorry, it's early. And I want to talk about what you guys are doing, because the bus, that's not a name for someone who avoids contact when they're going down north and south, right?
That is correct. I've had my share of collisions in my day.
Almost like little mini car crashes.
Absolutely, and that's exactly what it feels like. Is some mini car crashes, and as a result of that, you have a lot of joint pain through the process.
At what point in time in your career did you wake up daily feeling like, man, my knees? I'm feeling like what?
Well, the latter part of my career, as I got through year 10, 11, 12, it started to accumulate. And then, at that point, you start to say to yourself, I can't play this game that much longer. So from a physical standpoint, your body just starts to wear out. And
then other games, too. You were having a hard time getting the ball. your golf swing was starting to struggle with your knees, too, right?
Yeah, everything was starting to kind of come into play. And the more you try to do, the more that your daily activities in terms of life become threatened. And that's when you have to start to look at, all your alternatives.
So, Doctor, how did you get the bus to return to full form where he can now play for the Steelers again?
I mean, everybody's been asking him that as we've been going around.
Oh, it's not an original thought?
No, unfortunately it's not, no. They're saying things like, if it's 4th and 1, can we give you the ball? Can you still do it? And I think wisely he's giving it to somebody else to do. But no, we're here doing some patient education for Stryker Orthopedics, talking about different ways to maintain joint wellness and health, and really about maintaining quality of life. That's what it's all about.
Yeah, and so as a former professional athlete, you deal with a lot of joint pain, and I'm here to tell everyone that's watching, that's listening, that you don't have to live in pain. And I was one of those guys that thought you had to, that was just part of the deal. It comes with the territory, but it doesn't. And so you can reach out to your doctor, and you can develop a game plan for that joint pain and develop that action plan, and then go out and execute that, because you don't have to live in pain.
What are some things that you can do if you have joint pain before you actually have to have surgery?
So that's a great question, and I think that's probably what most people and patients want to hear. Whether you're a recreational athlete, a professional athlete, or a non-athlete, there are tons of things that can be done that are not surgical to make yourself feel better. So exercise, keeping the muscles that support the joints strong, sometimes medications, even over-the-counter things like Advil or Motrin can be helpful. Weight loss, if you're carrying around some extra baggage.
I need to do
that.
You see, I looked him up, Dad, just to check him out.
Come on now.
I need to do that.
And then a little bit more invasive, there's injectable therapies and things like that for people that have a little bit more arthritis. And really, at the end of the line, there's surgical options for people that really have end-stage arthritic problems. So there's interventions at every level for patients.
I'm curious, when you were playing for the Steelers, what sort of physical conditioning and also therapy, especially body work and soft tissue, fascia stuff, were they doing then versus what has been advanced now?
Well, back then it was really simple. It was massages. I think that was about the extent of it. Then you could go out on your own and do different things in terms of acupuncture, some other things that were available. But from a organizational standpoint, there was very few things that were available. Now, it hasn't changed that much. There are more things available from the team, that standpoint. But it's about the individual, and it's about you making sure that you take care of your body, because as you understand, in football, your body is your business, so you got to take care of it.
Especially when you have to be accountable for your own career, your own life. And I'm sure these rookies and young guys reach out to you all the time, like, Bus, what should I do for this? What should I do for that? Like, what is your advice to guys that hit the hole hard, like Zeke, to stay healthy over time?
My advice to those guys is make sure that you take care of all those aches and pains in the offseason. A lot of times, players, after they may get hurt late in the season or in the playoffs, and then the season is over, and then they're off to enjoy, they go on vacation, do all these other things, but they don't manage the injury. And I tell guys all the time that Franco Harris told me a long time ago, you've got to manage those injuries in the offseason so that they don't become an issue that next season, and they don't accumulate over time.
Is it possible to get back to 100%? in the off season?
You know what? I think 100% is a great
Relative
idea.
term.
Yeah, it's all relative. It's a goal. Absolutely, it's a goal. You want to be as healthy as you possibly can. But I think, you know, once you start to play football and you start to go through that pain situation in terms of injuries, I don't know if you ever get 100%, but you can get, you know, close to it, to the point where, you know, you got full functionality and you're ready to go and ready to play.
But you talked about this. You talked about this earlier about the importance of preparation, and I think that's the message here. There's a time for rest, but active rest is really important in trying to work through those injuries. I mean, you don't have a 12, 13-year professional career in the NFL unless you do those things right. And for the recreational athlete and for patients that are out there, don't just sit back and allow it to happen to you. Take an active role in your wellness. Do things to make yourself better. And I think you expressed that well.
Where's your foam roller? Why didn't you should have brought it for us and showed us some IT man stuff?
You know, it's funny. Some of those things have changed. Some of the things that they do with athletes these days look a lot different than they did 20 years ago. To the point sometimes when you look at how therapy goes down, sometimes you go, wow, that's kind of weird looking.
Right, they're doing that?
Yeah.
Now, outside of just, you know, orthopedics, now we have to get into some predictions. I'd love to hear your thoughts too.
I'm going to pass the mic on this one because he's much more educated.
Right, see, he's a smart one, so he's making me make all
Defer
those
to
predictions.
the expert.
Exactly right. Yeah,
The
right.
boss.
I'm not the expert. No.
The question is, were you the expert in that AFC title game?
I'm the dummy that's going to tell you what I think. I was that title game. Yeah,
I was wrong.
That was a rough one.
Do you root for the Steelers because you have this partnership with Jerome?
No, but I grew up rooting for the Steelers.
Okay.
So he's
you-
got history.
I mean, back in the 70s, Mean Joe Green, the whole 9 yards. I love the Steelers, always have. So
Speaking
He's
of,
got history. He's got history there.
so prediction before.
Okay, prediction. I predict that it will be a really good football game. No.
You are so weak. You are so weak right now.
I'm rooting for the Falcons.
Is everyone rooting? Because it feels like that to me. Everyone is rooting.
Yeah, well, the
for
Patriots,
them.
they've had so much success that it actually works against them in that, you know, everyone now, they've seen them win, they've seen them have success. So now everybody's saying, well, you know what, let somebody else win for
Give
a
the new
change.
guys a chance.
Yeah, get the Falcons.
he has to root for it.
18
I live in Atlanta, so I'm biased.
Got a little bit of a bias. You mentioned Mean Joe Green. Before we let you guys run, I would love to know what your favorite Super Bowl commercial is of all time.
Of all time, wow. I mean, you got to look at that Coca-Cola commercial with Mean Joe and say that was pretty special because it really touched the nerve, you know, because obviously me being a professional player, having dealt with, you know, young fans and all that, it means a lot more to see that commercial even to this day.
Yeah, and that was actually really before the commercials became a big thing. I mean, that's an iconic commercial. Yeah.
Do you feel, Bus, like in the city of Pittsburgh, with all of that they've been through and the tough economic situation that they're in, when you were playing, that there was a little something extra for the city and those fans?
Well, I think it was, and I think you felt the energy when you got in the stadium. I mean, that support was by far the best in the NFL in terms of not only did they support you when you won, they supported you when you lost football games as well. It was one of those cities where
ride or die.
It was a love affair with the organization, a ride or die, win or lose. They're there 100% of the time, and so they had a lot of losing periods in their history. It was always a packed stadium, and I think that's loyalty.
Speaking of loyalty, everybody keep it locked here all day. We're going to be streaming on Radio Row. Thank you so much to the Bus and Dr. Freehand for coming through.
Thank you.
And make
Thank
sure
you.
if you guys have joint pain, get that handled.